Good morning, everybody. I'm Paul Lisnick, and welcome to WGN-TV Political Report. This week, the nation marks 1 year since the COVID-19 pandemic halted every aspect of our daily lives. While the fog of battling the invisible disease at home continues to settle over much of the United States, there is some welcome news from Washington this week as President Joe Biden sets an ambitious goal for the spring and the summer.
All adult Americans will be eligible to get a vaccine no later than May 1. If we do this together, by July the 4th, there's a good chance you, your families and friends will be able to get together in your backyard or in your neighborhood and have a cookout and a barbecue and celebrate Independence Day.
Now, that announcement coming hours after a nearly $2 trillion stimulus package also got final approval from Congress and the president. Some Americans could see $1,400 in their bank accounts as early as this week. The American Rescue Plan is sending more than $13.5 billion to Illinois. About $1.6 billion of that will be divvied up between Cook, DuPage, Lake, Kane, McHenry, and Will County governments. Even as optimism begins to rise, a key part of the plan to defeat the virus is still moving slowly here in Cook County. Limited vaccine supply has stopped Chicago and several suburbs from expanding eligibility to match the rest of the state. And confusion over who exactly can get their vaccine at the United Center has tarnished the first week at the mass vaccination site. But county officials still working to get more doses out to high-need communities, launching a new mobile vaccination program this week. No better person to talk to than Cook County Board President Toni Preckwinkle. She joins me this morning to talk about all of that and more. Madam President, good to see you again.
Thank you, Paul, for inviting me.
Let's actually start with the notion that next week becomes the one-year anniversary that Cook County went into its stay-at-home order. I just want to get a quick reflection of you as to over this past year. Worse than you expected, not as bad, or exactly what you expected?
Boy, it's been an extraordinary year. On Wednesday of this week, we commemorated the one-year anniversary of our emergency declaration in response to the pandemic and acknowledged the tens of thousands of people in the state of Illinois and in Cook County who have succumbed to the disease. So it's been a very somber, sober time, but also, as President Biden said on Thursday, a time when we can be hopeful that we're seeing a greater production of the vaccine, and as a result, he anticipates that we'll be able to somewhat resume our previous lives this summer. So that's encouraging. But, I have to say that I'm very proud of the good work that our health and hospital system has done. I want to commend Israel Rocha, the head of our health system, and Drs. Rubin and Joshi, the head of our public health department, for their good work. Our challenge, of course, has been not only to stand up vaccination sites, but to equitably distribute the vaccine. And clearly there are some communities where folks are in greater danger. African American and Latinx communities suffered greatly from the pandemic, both in terms of the number of people who got the disease and the number of people who succumbed. And we're trying to be sure that we're equitable as we distribute this vaccine in response to what we know has been the disproportionate impact of the virus.
I know there's been a lot. Sorry, there's a lot of effort, a lot going on. I do want to take a look at a few things that I think need to be addressed. The United Center, well-intentioned as it absolutely was, had a really rough start getting out of the bay there, and who could sign up, who couldn't sign up, people at the beginning not getting their second shot appointments, and on and on. Now, Governor Pritzker made it clear that FEMA set a lot of the rules, but let me ask you, who takes the blame for that very rough start, and are things fixed?
I'm not going to talk about blame. I mean, this has been a very, very difficult moment for people in elective office and people, especially who have to lead in the executive branch. We have two critical issues. One, there's insufficient supply, and secondly, the supply is unpredictable. So, I mean, if you're trying to have a distribution plan and you know you don't have enough vaccine for all the people who want it, and you don't know when you're going to get the vaccine or what amount, it's amazing that we haven't had more glitches. So I'm not going to be critical of what's happened at United Center. I think we'll get it worked out. And we're trying very hard to distribute this vaccine equitably. We're trying to be sure that people in the communities which have been the most devastated, and that's Black and brown communities, have equal access to the vaccine. And at the moment, we're in a place where people who are not Black and brown are getting vaccinations in greater proportion than people who are Black and brown who are in communities that have been so devastated. So I'm not going to throw rocks at anybody. This has been a tough process, and we'll get it worked out.
All right. And let me talk about vaccination equity just a bit. You're certainly talking a lot about it. I understand that. Once again, this notion of FEMA setting the rules, even the percentages of who can get it, at least that's what the governor told us, I think. So let me just ask you, as Mayor Lightfoot wanted to make sure that with the United Center location, it's the west side zip codes that are getting served. That's one of the reasons it's there in the underserved communities. Are you happy with how that's happening now at the county level?
I should be clear. You know, the county is responsible for most of suburban Cook County. A few of our cities and townships have their own departments of public health. But Cook County is responsible for suburban Cook, and the city of Chicago is responsible for the city. You know, we've worked very hard in where we've stood up our mass vaccination sites to address the challenges of inequity in terms of the pandemic and inequities that existed prior to the pandemic. So our first mass vaccination site was in Tinley Park in the southwest part of the county. We also have mass vaccination sites at two of our community colleges, Triton Community College in River Grove and South Suburban in Lansing. We just stood up a mass vaccination site in Des Plaines. I mean, we're trying to address the challenges that the disparate impact of the pandemic has inflicted upon us.
President Biden said in his address to the public last week that he wanted everybody, all adults, to be available, to be eligible for vaccines by May 1st. And I'm just sort of curious. We know that the city, as I said in the lead-in to you, a little bit slower, probably part of what you're saying. It's the vaccine supply and all of that. But again, at the county level, will you be able to meet the president's goal of having all adults eligible by May 1st?
Well, my assumption is if the President of the United States says that all adults will get an appointment for a vaccine, he didn't say would be vaccinated by May 1st,
right,
but get an appointment for a vaccine by May 1st, that he knows about production more than I do and can make that assertion, just as he is asserting that we'll be able to join family and friends for gatherings on the 4th of July. So I presume that he's better aware of how we're doing in terms of Pfizer and Moderna and J&J vaccine production and can make that assertion.
Let me talk about the rental assistance program you announced earlier in the week, and announcing $73 million in emergency rent assistance to those financially devastated by the pandemic in suburban Cook, which means those families who earn 50% of the area median income in the community or have lost their jobs in the last 3 months. What I think is a good thing about this is it appears that the money is going to go to landlords. They are suffering too. There's been a lot of attempts to help renters, but the landlords are going, I've got mortgages to pay. My question is, do both and we heard about the mom and pop kind of landlords. Do you have to be a mom and pop landlord in order to get this money from the renters who are in trouble?
No, you do not. The program assists renters who apply directly. It assists landlords. And actually, we're also trying to work with groups that provide assistance to people who have trouble paying their rent, and we can work with them directly as well. So we're trying to use every avenue that's available to support people so that they don't get evicted, and so landlords so that we can support them and they can continue to maintain people in their homes.
Yeah, it really is a two-part equation. On Wednesday of past week, you signed a disaster proclamation for Cook County related to COVID-19. I'm just can you clarify for our viewers, what does the declaration give you in terms of the fight? Are you anticipating a surge in cases, the resources? What did that mean?
Well, we began with disaster declarations a year ago, and basically enables us to respond more quickly to the challenges that we face. For example, we have a procurement process, which is very open and transparent. I'm grateful, but it doesn't enable us to move quickly. And so, for example, as we tried to work out the deal with the Tinley Park Convention Center, we were able to do that and get that mass vaccination site up and running in a relatively short period of time. And it would have taken us months to do that for the regular procurement process. But because we have emergency powers, we're able to move that ahead really quickly. And, you know, we speak with our legislative branch, our Board of Commissioners, at least once a month on calls. And we also, of course, meet monthly. So there's several opportunities for commissioners to get their questions answered and to approve the actions that have been taken. But this is, as I keep saying, this is an extraordinary moment in our country's history. We haven't had a worldwide global pandemic since 1918, 1919. That's 100 years ago. So we have to be flexible. We have to be able to to move quickly to respond to the various challenges that the pandemic has presented, and that's what the Emergency Powers Grant provides us with.
And it touches everything, all parts of our lives. And you made it clear last year with regard to criminal justice and that system that you wanted to see a shift in the money from policing and incarceration to other social reforms. There has been some criticism that $181.7 million, call it 40%, of federal COVID relief has gone to the sheriff's office, direct labor payroll costs like payroll and benefits. Your budget director says that criticism isn't fair. You can't look at things piecemeal. What's your view?
Well, first of all, the jail was a hotspot. Congregate facilities provided a clear and present danger to their residents. I mean, that's why the first phase of the vaccinations went to healthcare workers and people in long-term care facilities. But the jail is a congregate facility as well, and we were faced with real challenges regarding the spread of the virus in the jail. And so we had to not only provide people with overtime pay, we had to segregate people, try not to have two people in a cell so they weren't spreading the disease in that way. So we had to reduce the population of the jail, and all the stakeholders worked very well together to do that. We had to try to single cell people. We had to invest a lot in personal protective equipment. We had to invest in, plastic shields. We had to make a lot of investments in trying to be sure that the facility was safe and that the inmates, the detainees in our detention center were kept as safe as possible, and the workers who were there were kept as safe as possible. So we made the investments that we needed to make to try to get control of the spread of the virus in the jail. And after a real challenge in the spring, we were able to do that, and we made the investments required to ensure that the virus wasn't going to overwhelm us in that congregate facility.
All right. It's a very complex problem, obviously, and we appreciate your time this morning and filling us in on everything that's going on. Cook County Board President Toni Preckwinkle, thank you again, ma'am, for your time. We'll talk to you again soon.
Thank you, Paul.